Hi, thanks for joining me today to learn more about the CariFree products and protocol. My name is Lacey, and I have worked at CariFree for over 5 years. My job here is to educate teams about the products, protocol, and really help you find out how to treat your patients better. So if you decide to use the CariFree products, I'll be your long-term contact person, and you can always reach me by phone or email if you have any questions. So I'm sure that you guys have had a lot of issues with patients with recurring decay, and that's what sparked your interest in the CariFree products. While I'm going through this presentation today, just kind of think about products you're recommending right now and how they differ from what the CariFree products have to offer. So today's agenda, we're going to be talking about the products and ingredients, how CariFree is different, implementation tools, and how to get you started. Just a quick background on CariFree. We were started about 14 years ago. We're located in Oregon. We're founded by Dr. Kim Cooch, who's a practicing dentist here in Oregon. He really got tired of having patients come in with reoccurring decay, and he was getting frustrated with the drill and fill method that he was taught in school, and he knew there had to be a better way to treat patients. So focusing on prevention was really important to him, and that is where our product line was born. So we partnered with UCSF, who was starting a CAMBRA protocol. CAMBRA stands for Caries Management by Risk Assessment. It's just a really thorough way to go through your patient's daily risk factors and really try to figure out what's causing that decay. So let's get started. We do have two different options as far as products and protocol go. Today we're just going to be focusing on products, but we do have a full CAMBRA protocol that includes a biofilm testing meter. If you would like to learn more about that, just let me know. All right, so when you guys look at the CariFree products, you'll see this symbol on there. We call this our CTX guide, stands for caries treatment, and this is showing you the protective factors that we have in our products. pH neutralization is a really important part of our product line. We really focus on keeping the patient's pH elevated throughout the day so that they don't dip down to that demineralization zone. All of our products are between an 8 and an 11 on the pH scale, so really elevated. I would encourage you guys to get some dental products from the supermarket, maybe some that are on your shelves right now. Get some pH strips and just test the pH of what you've been using or recommending. It's pretty eye-opening. There are a lot of acidic dental products on the market, which does not make sense, but it's kind of interesting once you start looking into pH. Antibacterial, we do have an antibacterial rinse that I'll tell you more about in a moment. We're using sodium hypochlorite for our antibacterial. Fluoride is in most of our products, but we do have a couple of fluoride-free options as well. Xylitol is in every single one of our products. We love xylitol as a protective factor. We're using that as our sweetener, but also bacteria can't metabolize xylitol into acid, so it's starving them over time. And it increases saliva flow, so that makes all of our products really good for dry mouth patients. And then the nanohydroxyapatite crystals are what we're using for the remineralization in our gel. It's just a more direct form of calcium phosphate that doesn't need saliva to activate it, so it's working on remineralizing all of your patients, even those dry mouth ones. You'll notice when you look at our products that there's a lot of numbers involved. Try not to get too hung up on that, but this is how we're naming those products. So if you see a CTX3 product, that means it has 3 of these protective factors in it. So just try to remember the higher the number on the product, the higher level of therapy inside. These are our three main products, starting with the CTX4 treatment rinse. This is the rinse that has the antibacterial in it. We're using sodium hypochlorite, so it's very broad spectrum. We're not going after specific strands of bacteria with this one. We are taking them all out. So this one is a great rinse for patients who come back. Every time you see them, they have decay. This will take care of that. We are using sodium hypochlorite, an elevated pH of 10.5, fluoride, and xylitol. The idea behind this rinse is that we're removing the patient's biofilm, and by using the protective factors in the 5000 gel after they rinse, eventually it's going to change the flora to only select the healthy bacteria over time. So this is not a long-term product that the patients are on. Most patients will be on this 3 to 9 months, and in a few minutes I'll show you how we determine that. This one does have 2 bottles in the box along with a little measuring cup. The A bottle has the elevated pH, the fluoride, xylitol, and the flavoring. The B bottle has the sodium hypochlorite, which is so strong we can't premix it. So that's why there's 2 bottles, and patients are just measuring 5 milliliters from each bottle into that little cup and swishing with it for a few seconds. It does say to use it for a minute on the box, but it's so strong it works on contact. I think that it definitely helps with taste expectations and compliance if you tell patients they only have to rinse with it for a few seconds. Speaking of taste, it's not delicious. we describe it as a minty pool water. It also comes in apple, so there's an apple-y pool water flavor option as well. You know, it's strong, but it's effective, so definitely want to talk to patients about the taste before you send them home with it. This is our CTX4 Gel 5000. So this is ideally the patient's long-term toothpaste replacement. So this one has the remineralization that I mentioned, an elevated pH of 9, contains prescription strength fluoride, so patients can only get this from a dental office, and it has xylitol. It's also a glycerin-based product, so it's very moistening for dry mouth patients, and it's non-abrasive, so some offices choose to have patients use this overnight in trays as well. We recommend that patients brush twice a day after rinsing. The reason we have the products done in that order is we want to make sure the remineralization is the last thing on the tooth surface. That's pretty important. The 5000 comes in mint and citrus. There are a couple of other fluoride options with this gel. We have an 1100 version, and then we have a fluoride-free version as well. And both of those lower fluoride concentrate options also come in the grape flavor, so great for pediatrics. This is our CTX3 rinse. We call this our maintenance rinse. This is great for that patient who likes to have a fluoride rinse in their everyday routine. It has an elevated pH of 8 and contains xylitol. This one comes in mint, citrus, and grape, and we are recommending that they use this twice a day before rinsing with the gel. When you do use our rinse and gel together twice a day like we recommend, it also brings that patient up to the daily therapeutic dose of xylitol, so adding an additional protective factor when they use it as we recommend. Some other great products we have, the CTX2 spray is an awesome product to use throughout the day just to keep your pH elevated, gives dry mouth patients some moistening. It comes in mint and grape. CTX2 xylitol gum has an elevated pH with xylitol. Same idea as the spray, just a different form. And then we do have a fluoride varnish that includes xylitol that you guys can use in the office for fluoride treatments. This one comes in mint and raspberry. There's a couple of ways that we package our products. You can buy the products in a case of 12, or we do have 3-month supply kits that are broken down into different risk levels for patients. It's kind of nice to have the 3-month kits, I think, especially for those patients who are using the treatment rinse and gel, because we want them to be on it for at least 3 months. It does save the patients a little bit of money. And it has a little bit of patient education in there, talking about the balance between risk factors and protective factors, and reminds them to rinse first and brush second. So I recommend that all teams get in the habit of using a Caries risk assessment form with their patients. It's really great to kind of open up conversations about what patients are doing daily, and this is what we use to help you recommend product. So everything above that gray line, the patient is filling out, usually when they're in the waiting room waiting for their appointment, just daily questions to figure out their risk factors. We're focusing on saliva, diet, and biofilm. So they're just circling yes or no. And then everything below that gray line is what you would fill out when you have that patient back in the chair. You're just taking a look in their mouth or looking at their chart to answer these yes or no questions. Once all of these questions are answered, you can go down to the risk identification category to figure out what their risk level is. So if all green answers were circled, that patient would be a low-risk patient. If even one blue answer were circled, that would put them into the moderate risk category. And then if any red answers were circled, that would bump them up to the high-risk category. From there, you use the product recommendation guide to send them home with product. So you can see here we have the high-risk patient taking home the CTX4 treatment rinse and the 5000 gel. Moderate risk patient would take home the CTX3 rinse and the gel, and then the low-risk patient can just use the gel. So in these picture examples, this is showing you how much is in the 3-month supply. So how do you know if it's working? These are the changes that you should see when the patient has been compliant for 3 months with the CTX4 treatment rinse and the CTX4 gel. So when you have that patient come back in for a 3-month reassessment appointment, which is what we recommend, changes you'll see right away are improved visual soft tissue health, decrease in bleeding gums when flossing or probing, and remineralization of early white spot lesions. Secondary changes, reduced sensitivity, better breath, feeling of cleaner teeth, hardening of tooth enamel, and improved tooth luster. And then long-term, reduced rate of decay, which is what we're shooting for, right? So once you see all of these changes, you know it's time to move that patient down from the treatment rinse to just the CTX3 rinse and the gel. Factors that influence treatment time: history of disease, number of risk factors, especially modifiable versus unmodifiable risk factors. I'm sure you guys have seen patients who are on a lot of daily medication, and that's just kind of their normal life from now on. So that does take a little bit more to overcome that. Presence of decay, severity of decay, the products that they chose to take home, and then, of course, patient compliance. So all of those things make a difference in whether that patient is on that treatment rinse and gel for 3, 6, or 9 months. Every once in a while, you might have a patient that's on it for a year, but that's pretty rare. So it's a pretty simple process to implement the products into your practice. Step 1, just assessing that patient's risk with the CRA form. After you do that, you put them into a risk factor category for the diagnosis. Step 3, recommending the products. And then step 4, having them come back in at 3 months for a quick reassessment. We do have some starter packages. I have sent you a catalog with some samples, hopefully. If not, let me know, and I'll get those on the way to you. The catalog has all of the pricing, all of the information that you need in it. Most offices have a 40% discount from what our recommended retail pricing is. So going over, let's say, the CTX 36 kit specifically, that comes in a case of 3. The case price is $294 for the dental office, which makes each kit $98. And then we recommend you sell that kit to the patient for $149. Now you have a little bit of wiggle room to to work with pricing because if the patients bought all of those products separately that are in that 3-month kit, it would cost them $216. So you can kind of play around with pricing as you see fit. I thank you guys for your time today. If you do have any questions or need more information, please give me a call or shoot me an email. That's what I'm here for. This slide has all of the documents that you need and research links, so you guys can actually access these at any time from these recordings. You can just download it. So you should have everything that you need there, but if there's something that you want that you don't see, like I said, just give me a call. Thanks for your time.